I hope all of you had a chance this morning to listen to Victoria Gray and her incredible story. I was really profoundly impacted by her story, and one of the things she said is that she wants every patient in the world to be able to access the therapy she did and any others like what we're working on as a collective. So I'm here today to talk about one such initiative that could help enable that future, and it's very exciting, but it's going to take collaboration. So I'm inviting you to understand this model and how we could collaborate together as a field. I think I might have gone blank with this. There we go. There we go. So this is a barcode. It's just a few black lines on a white canvas, and yet it revolutionized entire industries. It was able to transform global commerce, and combined with the internet, it gave birth to giants like Amazon. And it improved precision, accuracy, and created a lot of speed in the system. And as Lawrence of Arabia once said, big things come from small beginnings. So what can a simple barcode have to do with cell and gene therapy? Everything. See, it's in the quest for our own small beginning that we are looking for something that simplifies the system, makes efficiency routine, and makes scalability accessible. The model we have today to deliver cell and gene therapy cannot scale, because to scale you need access. And access is really comprised of three pillars: the place where something is, the knowledge about it, and the affordability of it. The first pillar is place. And why is place so important? Well, we still depend on a model nearly 70 years old. The first bone marrow transplant took place in 1956 at this hospital in New York. And since then, very little about how we deliver these therapies has changed. We still collect the cells in these places. We still ultimately manufacture them, although it's away, and then they come back to be transfused. Why, again, is place so important? This is Donielle Dubois. She was a young lady in South Dakota when she was diagnosed with Hodgkin's lymphoma. In the place she lived, every conventional treatment failed. She even had a bone marrow transplant. And the place she lived in had no other options for her. But another place in North Carolina did. There was a clinical trial where she was able to get enrolled. So she and her mom packed up the car and they drove 1,500 miles to North Carolina to participate, and she was the 8th patient enrolled. Fortunately, she was able to make that drive, and when she got this therapy today, she's cancer-free. And it's incredible to think that just taking her to the place allowed her to have that opportunity. But most people can't make that drive. We know that from the stats. The second pillar is knowledge, and it's very much tied to place. You see, most physicians, they think about this therapy as something that still takes place where medicine is more like experimentation. It is a foreign journey of patients. It's something that they don't have familiarity with because it doesn't look like medicine they deliver on a daily basis. We need to reinvent the model so that the therapies that we deliver look more like things already provided on a routine basis across the world. That's how we could potentially unlock the ability to scale the knowledge about how these therapies are delivered. One such model is actually blood donation. In fact, autologous blood donations are carried out 100,000 times a year. And it's very similar in that the blood is collected from a vein, it's processed, and then it's provided to the hospital to transfuse. It's standardized, it is routine, and it's trusted, and it's easy to understand across the medical ecosystem. So what if we helped cell and gene therapy look more like this commonly held system and model? What if we put some wheels on it, that first step of blood collection? Welcome to the world's first mobile leukapheresis center. It is a GMP-ready platform, fully integrated contained. It takes the team that can deliver this collection, this leukapheresis of the starting point, that manufacturing input, place to place, town to town, allowing the clinical sites to do just what they've always done, being able to provide the transfusion, being able to provide patient care, instead of focusing on a very expensive endeavor and developing the skill set needed to carry out this activity that can be done in this very simple model of place, taking it to the place. The last pillar is affordability. And you can imagine if you are a small rural hospital or a community healthcare, your affordability is limited. And investing in this infrastructure to collect the cells is a very expensive endeavor. Hiring the staff, training them, being able to provide this routinely. But one mobile leukapheresis center could serve an area like we have in South Texas, which is 70,000 square miles. It can serve that area, activating more than 20 clinical sites. It's a decentralized geography and a centralized cost efficiency. And what's incredible about that is you can think, as more sites get activated, then you're creating market access. With market access, the cost of goods goes down. That is how you unlock that final pillar of affordability. That's how you build true accessibility. That's why this is our barcode moment. With one simple, very simple innovation. We're bringing the therapy closer, making it available in more places. We're making it familiar to something the medical ecosystem already knows. And we're making it scalable, which ultimately unlocks affordability. And just like the barcode evolved into the QR code, still a very simple thing, but multidimensional, this model can evolve too. We can tie this model of collection into regional manufacturing facilities, taking the time to vein provide this therapy from weeks to just days. And I was a few weeks ago in Barcelona presenting on this topic to a lot of pharmaceutical leaders very interested in how to scale patient access, and this was a very compelling idea. It's a global need. And we've taken steps already to partner with organizations around the world. One such we just announced yesterday, Cell for Cure, which has manufacturing facilities in France. And they're able to also support these decentralized regional manufacturing, just like we can in South Texas, and many of our counterparts in the US are able to as well. We're very excited about that opportunity because time is life. And we have the greatest jobs in the world. We get to rewrite the future of medicine. We get to find the barriers to access and break through them. We get to build the bridges that enable these therapies to become the thing that Victoria talked about, available to anyone who needs them. And the responsibility to work together to realize that vision, to bring it forth. I want to invite you all to collaborate on this vision. It's a very simple thing, but it does take collaboration, it does take change. So if anyone is interested in working with us at BBG Advanced Therapies, among the community of different blood centers, as you heard from Jeff with AABB, we're all here together to support the advancement of this field. And I think with simple innovations like this and using the capacity that's already available in so many parts of this country, we can unlock this future where these therapies are widely available. Thank you.